Well, we have 300 late days down the line, plus peaks. We have 37,000 deaths, and double of that is excess deaths. So we have more than double amounts of that, of deaths in total in South Africa. So there's a lot of other deaths that happened during the COVID epidemic. The balancing act between protecting lives and livelihoods is always going to be a tricky one. And we have to try and find ways of maximizing our economic activity, as well as making sure that we manage the death in our hospitals and the illness. So if you look back and look about how South Africa has responded, I think that South Africa did the best that it could. I think there were some issues that were too harsh. I think the issues around uh, banning beaches instead of policing beaches, making sure people weren't crowded, and not being allowed to swim, is were I think should have been more temporary than they were. I think the curfews were good, and I think the alcohol ban was very important to control injuries and car accidents and deaths from that. We learned a lot in the last 100 days. We learned how to manage COVID infection in hospitals much better. We learned about high flow nasal oxygen, steroids, and how to make sure that we optimize the management of people in our hospitals. We learned how to make sure we didn't run out of oxygen, and we learned to rearrange and reorganize our health system. We also have vaccines that work, and I think the most important about the last 300 days is the fact that we accelerated vaccine development, and these need to be deployed at a global level to try and control this pandemic.
Right.
Uh, SARS-CoV-2 is a formidable pathogen. So it's out-tricked us, outmaneuvered us, and now we have new variants. And so we have completely underestimated our enemy. And the enemy is the SARS-CoV-2 that changes and has devastated both our economy and people in our country.
And a lot of the conversation, insofar as the response is concerned, is centered around this variant. Does something like a lockdown make sense given the challenges we know about what this variant actually does?
So lockdowns are meant to control or eradicate a virus, and we were never in a position in South Africa to eradicate or completely control SARS-CoV-2. And so what we had to do was try and implement our non-pharmaceutical interventions, like improve ventilation, use masks, wash our hands and keep our distance, avoid big crowds and social gatherings, and make sure that we kept far away from people as possible. But this is hard and impossible in a country where people use minibus taxis that are overcrowded. It's hard when we live in overcrowded households, and it's hard when we're poor and we have to go out to look for money. So it's very hard to control an epidemic of this sort in a low middle income country. And we have to try with these blunt tools to try and slow down transmission. So not control or eradicate, just try and slow the transmissions down so that our hospitals can cope with the people coming in who need to be cared for.
There's also a lot of talk around ivermectin. I have no doubt you've come across some of the comments being made. And so as we continue grappling with ways to even deal with people who experience severe illness, how much attention do you think this particular drug ought to be getting? And I guess a related question is, how much attention is the South African Medical Research Council giving it, considering, again, what's in the public domain?
So I've been watching that space very carefully, and it's a very tricky situation to be in. You know, we need good evidence that this drug works. We need evidence that it's effective, and that we're not going to have too much undue side effects. And I think the data is accumulating, and I do think that South Africa must make a call in the next couple of days to give advice to doctors who are trying to use it in their practices or in the hospitals. So I think we need to resolve this issue of ivermectin very quickly and give some definitive advice about how to use it and how to manage and evaluate it while we are using it in our.
Right. It's not a completely new drug, though. And so for people who are wondering why the data that was used to ascertain the circumstances under which it can even be used in humans can't then be extrapolated to understand whether it can be useful for COVID-19. I mean, what's the response to that? In other words, this isn't necessarily a new dimension insofar as, call it, the options are concerned. It's not a newly conceptualized drug. And now there are new questions about, well, if we've used it in some circumstances, why can't we use it for COVID-19?
So it's a well-known drug,
Yeah.
and there is biological plausibility that it could work against SARS-CoV-2. So you've got the drug profile, the biological plausibility. And what you do now need to know is how effective it is and what are the side effects in these situations. And that's imperative to know, particularly if you want to label this for this indication. And so the clinicians, the regulators, and the committees must work together to answer this question in a speedily fashion. There is no reason why you can't evaluate this rapidly in practice under guidance of our health research ethics committees and our regulator. So this should be done as a matter of urgency in our country. I see every day WhatsApp messages, doctors crying, people in the front line wanting to use this drug, and I think we need to help them solve the problem and to make sure that we can expedite the evaluation so that we don't waste time either with a drug that doesn't work or waste time not using a drug that could work.
All right, let's talk about vaccine procurement in South Africa. Government coming under fire in some quarters of society about the timing and the ways through which vaccines have been procured. News 24 reporting this morning that according to a leaked phone call that they're privy to, South African officials apparently actually didn't respond to requests for months and months to talk about a COVID-19 vaccine with Pfizer. Is the criticism valid, do you think, against government?
The only way we can control this epidemic is through a vaccine. The only way we can protect our healthcare workers is through a vaccine. So the top priority of any country, including ours, and of any continent, including ours, should be how to acquire a COVID vaccine. And so any tardiness or any slowness in responding to try and find vaccines is a very sad case. So I think we should do everything we can to make sure that we bring vaccine to South Africa. We do have a new variant, and we also need to know whether these vaccines are going to work against our new variant. And so it's very important to understand the role the new variant will play in our vaccine execution. And so that's a very important part of our rollout, is to make sure we have enough data to show that the variant is not impacting on the effectiveness of our vaccine.
Yeah. Hypothetically speaking, if we do find that this variant does have an impact, what are the consequences? Does that essentially take us back to square one?
Well, we have to rapidly change the vaccine design to accommodate the new variant. And talking to vaccine manufacturers, this will take about two and a half months. And so we have to be on the ball here. As you said before, this vaccine might have to be changed over and over again as we move through this epidemic. I heard earlier that you were laughing about being here for 2 or 3 years, but without a vaccine, we might be here for 2 or 3 years. We might not be able to travel. And we have to rapidly roll out vaccines, and we have to rapidly assess whether this variant is impacting our efficacy. If it is, we're going to have to change our vaccine in midway, and that we have to do. And so we do have to try as much as possible to bring this epidemic under control.
Right. I'm interested, as we take stock, Professor Glenda Gray, of the past 300 years, what this has meant for you and your colleagues. I mean, would you have ever imagined a context where South Africans would be eager to hear from scientists who are stereotypically thought of as being people who hide behind coat labs and stay in labs themselves, working with different chemicals? It almost feels to me that the profession of being a scientist has been thrust into the spotlight in unprecedented ways. And that must have some kind of impact on people like you who, for better or for worse, might have actually lived a big part of their lives in the shadows insofar as South African society is concerned.
Well, the last 300 days do feel like 300 years. And we've had a lot. It's been difficult, the last 300 days. We've had to become spokespeople. Scientists aren't good at talking in public, and we're not very good at explaining our scientific views. And we're also not used to disagreeing with government or with politicians. So it's been a very difficult time, and sometimes when you have to talk your truth, or you have to tell it the way you think it is, it sometimes can have a lot of repercussions on you and your entities.
Absolutely. Well, we'll continue negotiating it, hopefully with a fair amount of generosity. The team also quick to remind me or correct me. I think I said 300 years. It certainly perhaps does feel like 300 years, but of course it is just 300 days. Professor Glenda Gray, thank you very much for your time.